So I chose to look at an article talking about acute pulmonary edema in pregnant women. And I chose this specific population because I feel like more women are pregnant than we think, and when they come into the clinic, we want to make sure that this is something that we have on our radar. So this article kind of just talks about like the etiology of acute pulmonary edema, especially in pregnant women, because they think it comes from preeclampsia, which is basically how fluid accumulates throughout the body, and it's a way that it can get into their lungs. So this article talks about how it's kind of rare, but there are still high risks for the mother and baby if it's not taken care of. This article had 26 pregnant women who developed severe constipation and chronic constipation that also showed signs of acute pulmonary edema after the bowel movement. And they talked about the possible causes, which was unclear, but then they talked about how the fluid overload from the preeclampsia, the atypical preeclampsia, would have caused that. Something that they also talked about was the way to monitor for it. So just in case like this would have happened in the clinic, they gave us like signs and symptoms, and how like they should be referred out if we see these red flags. So just like if they already didn't have any hypertension, just if they had rapidly worsening shortness of breath, like if they seemed really scared, tightness of chest and cough, low oxygen saturation, tachypnea, anemia, if they have a history of chronic constipation before they were pregnant, then that's something to just keep in mind if you see that on their note. And if you see any fluid accumulation or edema during any amount of exercise, and any underlying conditions like preeclampsia in pregnant women. So that's pretty much the gist.